Hello, everyone. I am Dr. Krishna Narayan Dutta Baruah from Department of Cardiology, Assam Medical College, Dibrugarh, Assam. Today, we are going to talk something about the latest update in hypertension. Now, to introduce, as per the WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to CVD, which affects 45% people in the 40 to 69 age group. Raised blood pressure or hypertension is among the most important risk factors for CVDs. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. Now, in India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively, according to the WHO, World Health Organization. Despite that, nearly half of the people, or 51% of the men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of men and more than 53% of women living with hypertension did not get the proper treatment at the proper time. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women in hypertension worldwide, according to the WHO Lancet Study 2021. Now, the International Society of Hypertension, ISH, has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that in research-poor settings. Optimal care refers to evidence-based standard of care, and where essential standards refer to minimum standards of care to allow specification of essential standards of care for low-resource settings. The American guidelines, the ACC-AHA, has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low ASCVD risk. Among the low-risk adults with stage 1 hypertension, that is blood pressure 130 to 139 systolic and 80 to 89 millimeter mercury diastolic, management starts with non-pharmacologic therapy or the lifestyle management. If blood pressure remains uncontrolled at 3 to 6 months, then to consider the starting of pharmacologic therapy. This is according to the Zons D.W. et al. Hypertension 2021 study. Now, acute respiratory distress syndrome, or ARDS, is a potentially fatal condition involving lung damage, and experts often associate with the severe COVID-19. A recent study, which appears in the Journal of the American College of Cardiology, reports that metoprolol can reduce the lung inflammation and improve the respiratory function in people with COVID-19 induced ARDS. This is according to the JAM Call Cardiol 2021 September study. Lowering systolic blood pressure targets down to the 110 to less than 130 millimeter mercury range substantially reduced CV adverse events in the STEP randomized trial, affirming the sprint findings of an older Chinese population. Among some 8,500 patients ages 60 to 80 in China, the intensive target trimmed 26% of the composite CV risk. Findings from now a second major trial supporting a lower target could unite the guidelines, which even among the US professional societies range from thresholds of 130 to 150 millimeter mercury. This is according to the Zhang W. et al. And England Medical Journal in 2021. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on office blood pressure measurements, but also on out-of-office measurements such as ambulatory blood pressure monitoring, ABPM, or the home blood pressure monitoring. 24 hours and nighttime BP measurements were associated with the greater risks of mortality and a composite of CV outcome. Thus, they may be considered as the most relevant measurements for estimating CV risk. For every 20 by 10 millimeter mercury increment of BP measured at night, the risk of mortality increased by 23%, and the risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve the optimal BP control. The 2018 European guidelines equally recommend the 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve the adherence to therapy and BP control. Therefore, the 2018 European guidelines recommend, especially in context of lower BP targets, to start antihypertensive therapy with an initial dual fixed dose combination of ACE inhibitor or ARB plus calcium channel blocker or diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely N-nitrosodimethylamine or NDMA, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by the WHO, International Agency for Research on Cancer, to be carcinogenic in humans. In 100,000 patients would have received NDMA contaminated valsartan from Zhejiang, Huawei, the manufacturing site where the highest levels of contaminants were found. Every day for 6 years in the highest dose, it could result in 22 additional liver cancer over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 100,000 patients if they had taken the highest daily dose for 4 years. Valsartan recall accompanied by a significant increase in the rate of emergency departments visits of plus 6%. The HYGEA study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with a significant reduction in endpoints, including deaths. The HYGEA chronotherapy trial tested whether nighttime therapy in comparison to usual upon awakening hypertension therapy exerts a favorable CV risk reduction. The largest study included a total of 19,000 odd hypertensive patients. During an average follow-up of 6.3 years, 1,752 participants experienced the primary CV outcome. An ambulatory BP measurement was performed for 48 hours to collect data on how BP differed during sleep. The relative risk reduction for CV events was significantly improved for nighttime treatment when compared with awakening treatment. So these are some of the latest update in hypertension according to the European, American, Chinese, and the worldwide studies. So thank you. Thank you once again, all of you. Thank you.